Now, the percentage of people living with HIV in South Africa has decreased slightly. That's according to the latest HIV study by the Human Sciences Research Council, The study, which measures HIV prevalence in the country, has found that there are approximately 7.8 million people living with HIV in South Africa. That was in 2022, and that's compared to 7.9 million in 2017. What are some of the other findings from the study? Let's unpack it with the Acting Deputy Director General for Health Programs in the Health Department, Ramphelane Morewane. It's great to have you with us here on the program. And Infectious Diseases and TB HIV researcher from UKZN, Dr Richard Lessells. To both of our guests, welcome. Thanks very much for coming on. Dr Lessells, I want to begin with you this morning because it does feel a bit like this decrease in HIV infections from 2017 to 2022 is marginal, from 7.9 million to 7.8 million. Would you agree, or is this a win that we're going to take?
Well, I think there's lots of encouraging signs in the report. I think we know that when we look at prevalence, which is just the number of people living with HIV or the proportion of the population living with HIV, for many years that's actually been relatively stable or increasing. And that has been a reflection of the fact that fewer people are dying from HIV-related causes over time with the real expansion of ART. This kind of small decrease in prevalence suggests that now we're also reducing somewhat the number of new infections, enough that the total number of people living with HIV is going down. And so that is a positive sign. I think there's still data to come from this survey that will give us more detail about the kind of incidence, which is the number of new infections or the proportion of the population that's getting newly infected. And so we'll get more detail from the HSRC and their partners. But yes, encouraging signs with this.
Yeah, after many decades of either being stable or increasing, just to have a decrease is a good thing. And perhaps if we look at the percentage, it's 14% of the population in 2017 versus 12.7%. And perhaps that tells us a bit of a more of a positive story. Ramphelane Morewane, I want to ask you whether you were anticipating the results of the study for 2022, because let's not forget this period, 2017 to 2022, includes the period of the COVID-19 pandemic. And I wonder whether we were bracing for perhaps an uptick in infections during that period.
Good morning, and thanks very much again for having me. We were really expecting an improvement in the performance because over the years we have really implemented a number of interventions. And we were quite excited to hear these results confirmed by scientists, an independent survey, that indeed the interventions we put in place are beginning to bear fruits. We wouldn't have achieved it as a department on our own. We simply got to this far because we're working together with all stakeholders. We are coordinated under the South African National AIDS Council. We're working with all stakeholders. SANAG has actually pulled through almost all sectors of society to work towards HIV and AIDS prevention. And our own prevention measures and messaging out there, shared and distributed by various people on various platforms, have really reached out South Africans. But we must also thank South Africans for responding, because sometimes the messaging on its own does not yield results. When people it doesn't resonate with people. When we go into interventions that are really tailored to meet their needs, and people are responsive, then we can only celebrate. And we want to call on South Africans to continue to go for testing so that we know how many people we have, and those that have tested must then come back to treatment. But I'll deal with it maybe in a minute if I'm given another opportunity. But just to say for us, we're really expecting that we should see some decline. And I'm confident this trajectory is going to continue. until we meet our targets.
Well, that's a good way for me to segue into my next question, Ramphelane. You've made these gains, but how much of a threat do you reckon? And Dr. Lessells, I'd like you to weigh in on this as well, but let's begin with the department. The Treasury decision to cut HIV funding. So we've made all of these gains. Is that now at risk with the loss of this 1 billion rand in funding?
Look, any cut in the budget allocation, obviously, it'll make a dent into efforts that have been made. But we didn't want to cry when the cut was cut and simply sit back and say there's nothing we can do. We are supported mainly by partners also that are actually contributing largely to the work that we're doing. But we've also been able to rearrange, our way of doing things after we received the news that there's going to have to be budget cuts. So the way we have rearranged our way of work, the impact may be there, but it won't be that huge. We'll still be able to cover as much people as we want to cover in terms of our own target in our annual performance plan. But of course, we'd have loved to have more money so that we can then go out there, so that we can reach every South African with our messaging, so that everybody who knocks at the door looking for antiretroviral treatment is able to get it. Everyone who looks for condoms must get them. But currently where we are, we have resources enough to make us push in spite of the financial constraints.
Dr. Lessells, do you want to weigh in on this and touch on this issue of funding and whether we're at risk now? We're making gains, perhaps for the first time in quite a while. Are those gains now at risk with the loss of what is a substantial amount of funding?
Well, I think that is the reality, unfortunately. I mean, the progress that we're seeing here, this really impressive progress, is thanks to the hard work of many, many people across the health department, across the health sector, partners, NGOs, community-based groups. It's thanks to all their hard work. And of course, when there's funding squeezes, this puts a lot of that at risk. And it's not just domestic funding that's at risk. There's also funding from partners overseas and PEPFAR funding and things that's at risk. So it's a really critical time, and I think that we need to be so careful, because sometimes when we get good news, there's a sense of complacency that we're now back on target, that we're making progress. And we take our foot off the pedal, and actually, of course, the opposite is true. We're making progress because of the good work of many, many people, and we need to support that, and we need to push forward, because there's still a lot of work to do, as you've highlighted. Although there's lots of good news in this, it also highlights where the gaps are, and it tells us where we need to work harder to really push forward. I think that's critical. Yeah,
let's perhaps talk about one of those gaps, Dr. Lessells, this 15 to 24 age group. And this age group has been a challenge for some time, hasn't it? It's still the age group that contributes greatly to our HIV numbers. And then when we delve even deeper, the HIV prevalence in that age group is almost twofold for young women and girls. That, Dr. Lessells, is a major gap insofar as taking our foot off the pedal is concerned.
Well, it is. I mean, it's not so much new that. I mean, we've known for a long time that adolescent girls and young women are the most at risk of acquiring HIV, of becoming HIV infected. What we see in this report is, again, evidence that the younger men are doing less well when it comes to viral suppression. And so the real challenge here is in scaling up the prevention technologies that we now have available for the young women, but also really finding ways to bring men in for testing and treatment. And that's something that it requires us as researchers to up our game, to find kind of cost-efficient, really innovative ways to bring men in, maybe outside of the traditional health sector, community-based models, so that we can really improve the viral suppression amongst that group and therefore also bring down infections in the younger women.
Ramphelane, your final comments on this disparity between the sexes, because despite the 15 to 24 age group, it's also true across the board, right? HIV prevalence is 20% in women and 12% in men, according to the study.
Look, let me just start with where Richard started. I mean, in the age band that you spoke about. The results have indicated to us that we need to obviously diversify the way we approach the society, because society is not unified, as the results are showing. And we then have a program of the differentiated models of care, so that there's a package of services for particular age bands and particular economic classes, so that young people become an area of focus. So I just wanted to deal with that before coming into the issue of men not coming through. We do know that even the study itself shows that 69% of women are those that presented and submitted for testing, against 60% of men.
Right.
So, but we have a program of men's health. In fact, at the SANAC level, we've got the men's sector. We have just launched the men's parliament on the 19th of this month in November. And that is just how much we want to draw men back into the fold. But
Ramphelane, I'm so sorry to cut you off there, but I've got one eye on the clock and I am in trouble. We have to leave it there for now, but I think both of your points well made, and certainly a conversation we will have to continue at another time. To both of our guests, thanks so much for joining us this morning. Important issues there being unpacked in the 6th HIV prevalence study.